This is Out FM on listener-sponsored non-commercial WBAI New York. Out FM broadcast weekly, and I'm John Riley, and I'm joined by my co-host tonight, Stahimili Mapp.
Hi, this is Stahimili. Thank you, John. Thank you, John. So yes, we're presenting the kitchen table convo, which was a conversation that was begun around sort of a kitchen table conversation at Zami Nobla, which we'll explain exactly what Zami Nobla is, but came together a group of Black lesbians talking about their responses to and feelings around various issues, including COVID, and especially, I guess, generated by how we were feeling when we got the news about the Breonna Taylor case and the non-justice that occurred around that. So we got together and had a long conversation. And we wanted to bring that to the air so you guys could hear it, sort of have a continuation of that conversation. And so today we have four of us that are going to do this presentation and have a conversation: Miriam Adams, Shadra Pittman, and Edith Biggers. Let's all introduce ourselves. Let's start with Miriam. Just a quick introduction so people can hear your voice and hear who you are. Miriam?
Yes, Miriam Adams, located in Metro Atlanta, and I am the founder and executive director of Zami Nobla, the National Organization of Black Lesbians on Aging.
Thank you. And Shadra?
Hi, it's Chadra Pittman. I am the founder and executive director of the Sankofa projects and Forever, which is an acronym for In Violence, In Rape. And I'm a proud member of Zami Nobla.
Thank you. And Edith?
Good evening, everyone. My name is Edith Biggers, and I am the secretary of Zami Nobla.
Great. Is that all you want to say, Edith, about who you are?
Well, I save lives. I've been taking care of people with HIV for the last 20 plus years. So I'll say a little bit more about that a little later.
Okay, great. Thank you.
Thank you.
Good. So Shadra's gonna sort of start us off with a little bit of a historical kind of background and grounding for us, and then we'll hear from Miriam and with some other points that she wants to raise. So Shadra, take it away, as they say.
Okay, so I'm going to start by reading a quote by Audre Lorde, because I think that is really relevant. Some words she spoke in 1979. She said, "The woman is Black, so her blood is shed into silence. The woman is Black, so her blood falls to earth like droppings of birds to be washed away with silence and rain." Audre Lorde first said these words in 1979 in a chorale for Black women voices as a response to 12 Black women who had been killed in Boston. She was angry, she was frustrated, she had fear over the lives of Black women. And seems like in 2020, we are still fearing and having concerns, and we're frustrated over the lives of Black women and how Black women are not protected. So before we go to Breonna, I just want to say that before Breonna, in 1984, was Eleanor Bumpurs. Eleanor Bumpurs was an elderly woman who was living in the Bronx, New York. She was an African-American woman who was differently abled, and she was approached by officers who were trying to evict her from her apartment. A battle ensued, and she was shot and killed. That officer, back in 1984, was acquitted of manslaughter. So we fast forward to Breonna. And Breonna, on March 13th, was gunned down in her apartment in Louisville, Kentucky. Breonna was sleeping in her apartment. Officers came to her door. Her and her boyfriend were asleep. There was a no-knock warrant. So they did not knock on the door to let Breonna know that they were at the door. Her boyfriend was concerned, thinking that they were being robbed or there was an intruder. So he used his gun, which was legal. He had a right to have it in his home, in their home, and he shot out at the door. Breonna was shot 5 times. Now, before Breonna was laying in a pool of blood, which is sadly what happened to her, no one came to her aid. Breonna was an EMT worker. She was an inspiring nurse. And for many minutes, she lay in her apartment bleeding with no one tending to her. And so, you know, Audre Lorde's words are just so ever present and are so vital that all these years later, we're still having these conversations about Black women and Black women dying. You know, and it's important that we lend our voices to these conversations. On September, I believe it was the 25th, Miriam Adams actually was featured in livingoutloud20.com about Black lesbian LGBTQ activists expressing their outrage over Breonna. And so Marianne, if you could, as she is a warrior for justice and has always been that, could you talk about the importance of why you felt you needed to lend your voice to this conversation?
Thank you, Shadra. Absolutely. I was really honored when Darian reached out to me. He is the editor of The Reckoning, and he lives in Atlanta. He's a Black gay activist journalist. And oftentimes we are invisible from the conversation. Our voices are invisible. As everyone knows, we've been on the front lines forever. Black Lives Matter was started by 3 Black queer women. And we need to continue to amplify our voices. And so I took the opportunity to speak about outrage around the murder of Breonna Taylor. I was saddened and I was enraged by her senseless murder. And my heart goes out to her family and her partner and her friends. If I could just take a moment and actually read the quote that was in the article, I'd love to do that. The reluctance of Kentucky's Black Republican Attorney General, Daniel Cameron, to act with all due speed and without bias and bringing charges against the policeman was politics as usual and utter disregard for Breonna's life. And now the grand jury's failure to indict the 3 cops on murder really adds salt to the wounds. It sends a message to the Black community and specifically to Black women and girls that we are indeed collateral damage and that our lives are of no consequence. We were never meant to survive in this country, but still we rise. I raise my voice with the righteous warriors who are calling for the abolition of the police state and for the reallocation of funding to community programs and services. The struggle for liberation is unending, and we will continue the fight for justice for Breonna Taylor's life, and indeed for us all.
Thank you, Marianne.
You're welcome.
Yes, that was that whole piece about justice and injustice being enacted upon us and our bodies and who we are, Marianne and Shadra. You know, it's just one of the many things that we are enraged about, and how the rage that we feel, of course, has this impact on us physically and mentally, our health on both ends. We're dealing with those things along with the fact that we're also encumbered by this virus that's, you know, affecting our community as Black people and as lesbians as well, Black lesbians as well. So we'll get back to talking about some of that rage and how we express it and how we're going to care for ourselves in a minute. I wanted to give you, Marianne, and a chance to talk a little bit about the work you're doing, and Edith, the work you're doing, a little conversation between the two of you to talk about what we're doing. I mean, Marianne, you're running Zami Nobla, as Edith said, she's been saving lives. So let's hear your conversation about that.
Thank you, Stahimili. First, I'd like to give the audience some information about Zami Nobla and who Zami Nobla is, and what it is and what it stands for. So in 2011, after being in Atlanta for a number of years, I realized that older Black lesbians were disappearing from the community, from the social scene, from social networks. We were invisible, and we were impacted by social isolation. And so I wanted to do something to mobilize us because we were actually losing a wealth of resources. We were losing a community of women who had been on the front lines for 20, 30, 40 years. And those were gifts and graces our community acutely needed. And so if this was happening on the local scene, indeed, it was also happening on the national scene. And so I started to mobilize Black lesbians who were 40 and older, so we could build a base of power nationally. And what that looks like, it looks like services and advocacy and community engaged research. It looks like grassroots organizing. We're doing programming around housing justice and food justice, around community music, around film, around book clubs. And we have a podcast where we're amplifying the voices of Black lesbian elders. We are building an archive of those stories so that they're not lost forever. And we are also developing a whole series around financial literacy for the LGBTQ community. Health and wellness has been at the forefront of our work. And we also believe very strongly that we have to do intergenerational work if we are to survive. It's indeed extremely important. And so that's sort of who Zami Nobla is. We have a lot of programming, and I know Shadra is going to talk about something that we have that's very special that's going to be coming up in a couple of months. We're also, we started to do some work with the trans community in Atlanta around housing justice. We realized that there are those of us who are doing this work in silos. And a couple of months ago, we organized the Atlanta Metro Lesbian and Trans Housing Alliance. Be looking out for that. We're going to be doing workshops. We're going to be doing symposiums. We're going to be doing needs assessment. And we're going to be doing, we are renovating a house for 2 Black lesbian elders. And so is Transforming and Trans Housing Atlanta. So we're really trying to work together and do this grassroots, and we cannot do this work by ourselves. And so this is just some of what we're doing. I know I don't have time to get into everything, but hopefully you'll have us back, Stahimili, and we can talk further about the work that we're doing around that.
The work that you're doing around the COVID crisis is really, I think the work that is really pertinent for right now as well. So go ahead, I'm sorry.
Okay, so in July, Zami Nobla partnered with University of North Carolina at Chapel Hill, specifically with an LGBTQ lesbian and queer researcher, Dr. Tonya Poteet. And we are conducting a qualitative and quantitative research project on the coronavirus in Black lesbians over 40. We're facilitating focus groups right now. We have a sample size of 100 lesbians nationally. Once we complete this data set, we will start doing the quantitative component. And we will be recruiting 300 lesbians, Black, white, and of color, because we want to do a comparative analysis of how COVID is affecting us. And this work is vital. And as we know, the coronavirus is really impacting us in terms of inequities that we already faced prior to the coronavirus. There are many of us who are impacted by poverty. We work on the front lines, and we need to hear our stories. We need to hear our voices. There's a dearth of resources, research on Black lesbian elders. And so we really want to fill that gap. We want to hear from us. And so Edith, I know that you have been doing work at Fulton County Health Department for 20 plus years, as you mentioned, working with people who are impacted and affected by HIV. And I know these folks are at the margins of the margins. So could you talk a bit about what that work has been like a little bit prior to the coronavirus and what it's like now with the patients that you're seeing and helping every day, and how it's affecting you also as a Black queer physician.
Okay, thank you, Marianne. Thank you, Stahimili and Shadra, John. No, I've been doing this work with people living with HIV for the last 20 plus years, and at the Fulton County Department of Health and Wellness, which is the largest, Fulton County is the largest county in Georgia. So we take all comers, anybody who lacks insurance and who's HIV positive. I welcome them into my clinic. We are funded by the Ryan White grant. That is a national grant that is for to take care of people living with HIV and AIDS who are uninsured. And so we're talking about people who are already on the margins of society, people who are already, so many people think are the cast-offs of society, and nothing, of course, nothing could be further from the truth. You find that, unfortunately, I guess I started this work because I read an article in the New England Journal of Medicine many, many years ago. That's supposed to be the preeminent medical journal. And it said that at the time that certain people should not be given access to the new medications that were new at the time. And the people who shouldn't be given access were my constituents, people who were poor, people who were Black, people who were of color, gay men and women, trans individuals. Those are my constituents. And so I decided at that point to just devote my life into taking care of these folks who have become so dear and near to my heart. So I decided when COVID-19 started, that no matter what, I still needed to take care of folks, that my patients needed to be on their medications, because after all, COVID-19 is affecting all of us, but we still have to pay attention to other comorbidities, other illnesses that we all have. And so that became a mantra and a mission. So what we do is, I'm on the 5th floor. We screen everybody who comes in. We take their temperatures. Everyone wears a mask. That's non-negotiable. Keep as much normalcy in people's lives as I can do, to keep them on their medications, to assess their housing needs, and to try to address those housing needs. And we're being successful. And I'm also, I'm kind of a one-on-one kind of doctor. I talk to everybody about the importance of keeping themselves safe. We give out masks. We tell them, keep yourself safe. We're going to get through this, but we have to keep ourselves safe.
So thank you, Edith. Are your patients being impacted by COVID-19? Are they able to get tests? Are they being tested? Are they able to, can you give us a sense of that?
Sure. At the beginning, in February, early on, it was really, really hard getting a test. I mean, I have several friends who had symptoms that sounded like COVID, but they couldn't be tested. As the months have gone on, it's become easier. There have been more and more testing sites. And in fact, in my building, we have we can link people to testing sites. We can help them make appointments to be tested. There are many, many testing sites that pop up and they stay for a while. Some of them are still going month after month. Some of them are pop-ups. They last for a month and then go away. And they're throughout the Atlanta area, throughout Fulton County, throughout many of the counties in Georgia. But access is still important. Even though the resources are out there, you have to know that they're out there.
What about your own personal safety? Are you concerned for your personal safety? Are you concerned about going into the clinic every day and that you might put yourself at risk for COVID-19?
Absolutely. And that has evolved as well. I didn't bring a mask home with me, but I have an N95 mask, which is supposed to filter out at least 95% of viruses. And we also wear face shields, but I insist I walk through the clinic all day long. I walk through the lobby all day long, telling people, cover your nose, cover your mouth, protect yourself. We have to protect each other. But absolutely, at the beginning, there's still some places that I won't go. There are many places that I won't go. I basically go to work, come home, go to my partner's, occasionally go to the grocery store, but there are so many places because I'm very, very mindful of being safe.
Edith, this is Stahimili. Are your patients seeing having any particularly different impact on them as a result of the COVID-19 virus, considering their marginal status? Are you seeing more illness around COVID or comorbidity issues around COVID?
That getting out and getting the word out that we're still here, that we're open. A lot of my patients, I'm glad to say, are being tested, and I'm pretty happy about that. And yet they sometimes don't understand that when you're tested, that's your result for that moment. That moment in time.
That's right.
That has nothing to do with what we're talking about today. You have to continue to keep yourself safe.
How long is one contagious once you establish that they are having the symptoms? How long does that patient or that person remain contagious? In other words, how long are they shedding the disease in the community?
Sure, shedding the virus. Certainly, conventional wisdom tells us that 10 to 14 days. But again, 10 to 14 days is an estimate. I'm not going to put myself out there. If I were in contact with someone who I knew was positive, I don't think that, okay, it's day 15, there's no more risk.
Right.
No more of a risk. Certainly, I think that we have got to keep our mask on regardless.
Well, I'd like to, if we have a moment, to hear from you, Stahimili and Shadra, about your experiences around COVID, how you're being affected and impacted. What I've noticed is there's a lot of misinformation about COVID-19, a lot of intentional disinformation that, I believe that we need a public education campaign across this country. Many people simply don't even know how to wear the mask properly. They have it on their chin, on their head, on their neck, on their chest. A lot of people just simply don't know how to wear the mask. They don't even know when to wear the mask. And I just think it's a shame that we just don't have more public education around this. And a lot of people are certainly feeling confined and restricted and not understanding what to do, how to do, when to do, why to do. And there's also a lot of shame and stigma attached to people who contract the virus, because people feel like, well, you did it because you weren't doing what you were supposed to do. And so just a lot of just chaos around it. So I'm wondering what you all are experiencing where you are in your spaces. I know you're in New York City, and I know Shadra, you are either on the West Coast or in the Deep South. I'm not sure where you are.
I'm on the highway mostly.
Right. So,
Right.
so, Edith has given us her perspective as a clinician, and I'm just curious what you all are seeing on the ground.
Well, Stahimili, you want to go first? New York was hit so hard. That's my hometown, but
Yeah, we're hit.
pass it
Still
to
hit.
you.
I'm living in the zone that is peaking again. Really, I'm really just trying. I'm down for however long I have to stay, quote unquote quarantine. I just have to do it. But personally, I'm trying to manage my anger and my rage over people who are just ignoring the guidelines. We have leadership in this country who just just refuses to admit that people are dying. 200,000 plus people are dead already, and more are going to die. The White House has become a super spreader. I mean, I'm enraged. I'm enraged when I go out in my neighborhood and people are not wearing masks, because I don't want to be outside, but I have to go out for occasionally to get things done, as Edith was saying. But and so people are just, there's not enough caring, I feel like, for people, for others, that you wouldn't even wear a mask. So I'm really trying to manage my rage. I want to get through this rage moment that I'm in. That's why I was so happy to come onto the call for the kitchen table conversation, because I needed to get that off my chest, and I needed to do it in a safe place with the conversation with my sisters. And I think there are a lot of us, Black lesbians that are used to being out there. We're going to talk about this in a minute. Used to being out there on the front line doing work, and we can't. So how are we supposed to be dealing with, our rage around Breonna, our rage around all of the other stuff that's going on when we can't even leave our houses? So I'm trying to manage that.
And I'll just say, as a mom, so I'm a mom of 2 boys, 14-year-old and a 12-year-old. And I also have a mom who is in her 80s. And so it's been very frustrating. One, I've been very annoyed by the way in which the mask wearing has been politicized. Very annoyed by the lack of leadership, as Stahimili was saying. Very frustrated that life as we know it has been paused. I saw a quote that said, Mother Earth has sent all of us to our rooms to think about what we've done, and I think America in particular has blood on its hands, from the Native American genocide, the transatlantic enslavement trade, all that Black people have gone through in this country, all people really who have been marginalized. I think, for many of us, we're used to having rules and knowing what it means to stay put, right? Women, as June Jordan says in her poem about my rights, I want to go out and take a walk and think about my life. Well, we can't do that as women, right? We have to think twice about that. As Black people, we know there's certain places historically we could not go. Even today in 2020, there are places. I think for the majority of people, like the Proud Boys and people who are of that mindset, they've never been told to sit down. I think there's a certain arrogance around this COVID situation that makes me very angry, because I know what it's like to be told when and where to enter. And I wish people would really take this as serious as it is. And I think if people did, we'd all be able to get out of this and move forward, and resume our lives. But we have lost a lot of people. And as I always say, that many people, over 200,000 people who have died, there's a debt to be paid for that spiritually, I think.
Yes, thank you. I don't want to leave this conversation. I want to take but a second, but I really want to underscore this whole inequities around COVID. And I think it's really faced us in a way that I don't think people have been paying attention to. The President of the United States is talking about COVID is not anything to be feared, and it's something that you can get through very easily. But of course, we do know that most people don't have access to the evidence-based science that he does. They don't have access to the $1 million doctors. They don't have access to treatments that are still in the experimental stage. And so we have COVID For example, I live in Georgia where there was never any Medicaid expansion, and nor in any red state in this country. And so you already had people who had no medical treatment, no medical insurance. And now with COVID, you have people who are afraid to even go to the doctor if they have symptoms because they know that they have no insurance and they know they cannot afford it. And, people are not really talking about that. If you go to the doctor, you have insurance, then, here's a tier, here's another tier, and there's another tier. And so I think that we have to continue to fight for equity. We have to continue to fight for social justice. We have to continue to fight for access for everyone. And it's a fight that has not ever stopped, has never ceased, and will continue to be at the forefront. So I just really wanted to say something about that particular health and equity before we left this conversation.
Yeah, it's a bit ironic that, these folks that have, leadership positions in government, getting access to the best care, the best medication. I'm sure that our sisters and brothers that don't have that aren't going to have access to the experimental stuff that, may be useful down the line, and pay no taxes. So we as the taxpayers are paying for their treatments. This inequity just, continues on so many levels. I mean, we can't get the care, but then we have to pay for the care of folk who don't even pay taxes to keep the hospitals and the ambulances running.
Absolutely. And we won't even talk about the people who are unhoused and homeless who are impacted by COVID. Where are they going? What are they doing? What refuge do they have?
Right.
And we could just go on and on about
we could. And we're going to come back to this conversation in the future. Shadra, I'm sorry, are you trying to jump in here?
No. I was just going to say that whether it's, Black maternal health, whether it's COVID, whether it's Black Lives Matter, we always seem to be the ones whose blood is being spilled. Exactly. And, coming back to Audre, it's time that things change. And that's part of the reason why, Zami Nobla came forward and put forth a statement, and we did the kitchen table to bring this conversation to the forefront, because our voices need to be heard. Oftentimes when Black women die, no one's talking about it. We're not just dying because of police brutality. We're dying at the hands of people who love us too, who look like us. So that needs to be talked about. There's just so much to unpack. Before we go though, I do want to, if I can, Stahimili, if you want to say something else, but I just wanted to say what our upcoming event is, because that speaks to the mission of the work of the organization.
Sure, we definitely want to look at ways to wellness, which is one of the things that Zami Nobla is doing at the moment. So yeah, Shadra, you can go ahead and certainly advise us what's going on.
Okay, so for information about the organization, Mary Ann, you can visit
www.zaminobla, ZAMINOBLA.org, www.zaminobla.org.
Yes.
For more information. You can also visit us on Facebook and Instagram and Twitter.
Yes, and so we have some wonderful programs that we've been doing throughout COVID, ukulele lessons, yoga with Miriam. We also have been having a film festival. We've done all sorts of things, but we have a film that is coming up on October 24th, and it speaks to really the mission of Zami Nobla with regards to intergenerational work. The filmmaker is Kai Thomas, who's a director, and she follows the life of Queenie Lawrence, who's a 73-year living Black lesbian in New York, who has applied for the Stonewall Houses, which is the first LGBT affordable housing. So she follows her experience. So, that's going to be on October 24th. It's $5 for members of the organization and $10 for non-members. But check the website to find out more information, and please join us, join the organization, sisters out there, and join us for this film viewing.
So yeah, wellness is really key. Mary Ann reached out to us. She did a survey, found out what did we need, especially when we were trying to deal with the lockdown at the beginning. I shouldn't say lockdown. I take that back. When we had the quarantine. And so, sisters were saying, well, we're here in the house. We can't go out. We can't see our partners. We can't have our friends. What are we going to do? what do we need? And Marianne, you were great. I mean, you found out what we needed. So out of that comes the films, comes, different activities that Zami's doing to try and fill that space for Black lesbians who now are, sequestered in their homes. And creating, as you said the other day, I thought it was so beautiful, Shadra, creating a new paradigm for aging lesbian activism. So Miriam, what does activism for aging lesbians look like?
Activism is not just one thing, it's many things. I've been a bit frustrated lately because I've seen on the streets generally that a lot of young activists are saying, this is not your grandmother's revolution, this is not your grandfather's revolution. I've been really puzzled and befuddled by that because I'm not sure what that means. I think it's just another distraction for us, another way to keep us from doing our work. And activism, we need everybody doing everything. Activism is just not boots in the street. It's just not protest. We have to have someone who is who has the skill sets. We need the wisdom. We need somebody to be strategizing. We need a tactician. We need somebody who can fund the folk in the street. We need somebody who can mobilize. We need people who to call the elected officials. We need people to be doing texting. Zami Nobla just finished working with, what's her name? In Atlanta.
Oh.
Who ran for governor of Blake.
Gosh.
Stacey Adams. Stacey Adams, right.
Yes, Stacey Adams. Abrams.
Mary Adams, Stacey Abrams.
Sorry, sister. We got a lot on our mind tonight.
That's right. We just finished working with Stacey's organizations, and we were trained to do voter registration and to also help increase the census count, because we know how important it is here in Georgia and around the country for Black and brown people to be counted. If we're not counted, that means that those dollars are not coming to our communities to put into resources and services. And so in 30 minutes, Zami Nobla was able to text 6,103 people to tell them to get out and fill out this census form. That's tremendous work. That's activism. The fact that we've been doing the work that we're doing around COVID and Black lesbians so we can have a voice, that's activism. The fact that we have a podcast and we are collecting these stories, that's activism. The fact that Edith has been working for 20-something years, not only advocating for her patients, but teaching them how to advocate for themselves. That's activism. The fact, Stahimili, that you're right here as a producer at this radio station and that you're having us on and that we're visible and telling our stories, that's activism. The fact that Shadra is doing the remembrance of our ancestors every year so that folks will not forget, that's activism. It's all important. It's all necessary. It's all needed. And we know that Black, queer people, Black LGBT people have been on the front lines doing activism since Jesus was a girl. We all do know that. And that's really important. We have been there. Bayard Rustin was the architect of the 1963 March on Washington. We all know that. We have been seen and unseen since the beginning of this country. And so we will not be ignored. We will not be erased. We would not be invisible. We are here. We are going to stay here, and we're going to be out loud and proud and continue to do our work.
And we are going to vote. And we are going to vote, no matter what it takes.
We're going to do it. That's absolutely. Time is coming close. We're coming to the end of our program today, and I just really want to thank all of my sisters for showing up for us and for the work you continue to do for aging Black lesbians. So, we're not counted out. We have work to do among ourselves and among our people, and we've always been there, and we will always be there, as Marianne said. And if we're not in the streets, we're in our houses. Yes, I'm sorry, go ahead.
Can I just say really quickly, we are conducting focus groups with Black lesbians who are 40 and older, who live anywhere in this country. We need you. We're incentivizing people, $50. It takes an hour of your time. We want to hear your stories. We want you to participate in these focus groups. So please reach out to us, www.zaminova.org. We'd like to hear from you. We want your stories. We want you in these focus groups.
Great. And Shadra, you're going to take us out?
I just wanted to say that I appreciate the work that all of you are doing. Dr. Biggers, for you putting yourself on the front lines every day. Marianne, for you giving the visibility that you do. And actually, you were the one that said the quote, the paradigm quote, I remember. But I don't take stuff that's not mine.
All right,
we were talking
my
about it.
bad.
I'm gonna give that back. I don't take what's not mine. Stahimili, thank you for what you were doing on the front lines in New York. It is just, it's an honor. And I just want to leave this, if I could leave you with a quote. This was said in 1861. She said, "But where could I turn for protection? Whether the slave girl, the enslaved girl, is as black as ebony or as fair as her mistress. In either case, there is no shadow of law to protect her from insult, violence, or even death." This was 1861, Incidents in the Life of a Slave Girl by Harriet Jacobs. And in 2020, we're still talking about it. But we are going to make sure that we protect ourselves. And we were meant to survive. We gonna survive. So that's all I can say.
Ashe, 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 sister.
As Audre Lorde says, I am